Greetings, Doctor. Please allow me to inform you of how to interface with this hospital. You can tilt the control stick left and right while on this screen. This will allow you to select which doctor's episodes to experience. Should you wish to change the difficulty of your operations, point at the difficulty icon. Then press the A button on your Wii remote. Difficulty settings only apply to the doctors that perform operations.
Open the door. He wants to talk to the prisoner.
What? The guy with the 250-year sentence? I wasn't informed of this.
Here's my authorization from the HHS. Any problems?
I'm sure he won't say a word. He doesn't remember anything.
It's been a while.
What do you want?
You're needed for an operation. in exchange for a reduced sentence.
You want me to operate?
That's right. Here are the details if you want to see them. Take your time, think it over. But remember, you'll never have another opportunity to save lives.
Save lives. Again.
Get out. This is Resurgam First Care. You'll be operating here. The only time you'll be out of cuffs is during the operation. Remember, this is 5 years off your sentence. Questions?
None. I'm just here to do my business.
Hey there. Hank Freebird. I'm a doctor here. I'll be your support for this operation. What's your name?
His name doesn't matter. Let's keep the contact minimal. His prison number is CR SO1 if you need to call him anything.
I see. I understand.
Now get started. We'll be waiting here for you.
Well then, I'll be explaining the gist of this operation.
I'm told we'll be using an old CVR for a DCM case.
That's right. But, will you be alright?
What do you mean by that?
I heard from the man outside that you have no memories. This isn't just some way to pay a debt. A life's on the line.
You don't need to worry about that. Let's operate.
Well then, let's begin the operation.
The patient's vitals are low. Get me a syringe. The green medicine is the stabilizer. All right, injecting stabilizer into the patient. Vitals are recovered. Stabilization complete. Next, we must open up the chest. Ready the antibiotic gel. We must disinfect the entire incision area to prevent infection. Disinfection complete. Beginning incision. Scalpel. All right, trace the guideline to make the incision. Incision complete. Starting now, the real deal. We need to find the affected areas. Ready the ultrasound.
The affected areas should appear as black shadows. We found an affected area.
Found it. The yellow vial contains the antiviral drug. All right, the drug's working. Prepare the scalpel for incision. Affected area has been opened. Using the drain. Now to suture the wound. I'll need the forceps first.
We'll treat the myocardium with the overlapping method. First, pull one side of the myocardium across the incision.
Alright. One side has been overlapped. Alright. Next suturing incision. Prepare the sutures. I'll need to suture the wound before it opens up again. First area has been treated. All going as planned.
The test did confirm multiple affected areas, though.
Don't worry. We'll find them all and treat them. Alright, drug's working. Prepare the scalpel for incision. Affected area has been opened. Let's close the wound before it hemorrhages again. Forceps. Next. Alright. Next suturing incision. Prepare the sutures.
That's the second area done. Your skills are amazing.
Don't waste my time with your opinions. Let's keep going. That's odd. There should be more affected areas. Get the ultrasound out of my way. It's not helping anymore.
What do you mean? Tell me what you're thinking.
It's a simple fact. The ultrasound can't find everything. Let's palpate the organ directly to find them.
You're going to feel the areas? Would that be okay?
Inject the...
You won't find anything if you don't take your time. Try holding your hand there for a little while longer.
I've found an abnormal area. Injecting the drug. There it is. Prepare a scalpel. Making an incision. Affected area has been opened. Using the drain. Let's close the wound before it hemorrhages again. Next. Alright. Next suturing incision. Prepare the sutures. Suture complete. Moving on to the next area. I've found an abnormal area. Injecting the drug. I've found an affected area. Beginning incision. Affected area has been opened. Using the drain. Let's close the wound before it hemorrhages again. Forceps. Next. Alright. Next suturing incision. Prepare the sutures. Suture complete. Moving on to the next area. I've found an abnormal area. Injecting the drug. Affected area has been opened. Using the drain. Let's close the wound before it hemorrhages again. Force. Next. Alright. Next suturing incision. Prepare the sutures. That should finish the treatment procedure. Now, let's close them up. Beginning the incision suturing.
Once we're done here, the operation will be over.
Get the antibiotic gel ready to cleanse the sutured wound. Alright, let's bandage up the incision now. Operation complete. Let this disease pass from this world.
Impressive. I never thought I'd see surgery like that.
I can still do it. lives.
Impressive. I can see why you were called for.
Your opinions have nothing to do with my skills.
Looks like it worked. But I wonder if it's all right to use a procedure that's so outdated.
That was a fine operation, Doctor.
Something.
Thank you.
Who is he anyway? Ooh, is he a famous
I
doctor?
didn't do anything worth being thanked over.
How should I know? He does have some
I
amazing skills.
see.
Doctor, huh?
That was a fine operation, Doctor. Thank you.
Life.
Yo, kid. Came by to see what you're up to. Man, I didn't think you'd be living in a refrigerator.
Temperature's kept at 0 Celsius to reduce bacteria. And so I can't kill anyone.
Bacteria cultivation, huh? Pseudomonas, Vibrio, Micrococcus? You know, plenty of bacteria can be grown at this low temperature.
And you are?
Gabriel Cunningham. And I'm in charge of the guy you worked on. I want to consult with you about something.
Consult with me.
We've got a patient with tumors similar to Kaposi's sarcoma. Skin, lungs, small intestine, they must be excised at once. How about it? You think it can be done?
There's not enough information to make a conclusion. But depending on the patient, I won't rule it out entirely.
Is that so? All right, it's decided. Let's go.
What are you talking about?
The operation. You'll be performing it on that patient.
Me?
What's wrong? That's why I came out to see you.
Please check the arterial forceps. Are all the medicines ready?
We're running late. Can you check on our transfusion supply?
I'm putting extra trays here. Where's the anesthesiologist?
Oh, come on in. You're late.
You are...
Maria Torres. I'll be assisting you this time. You've heard the details, right? Read the charts, too.
all right?
I've seen you before. Have we met?
I hear this is a tough condition to deal with.
Yeah, you're right. Let's start the operation then. The focus of this operation is tumor excision, but... Well, it's odd. Infections like this aren't all that rare. Even so, we can't pinpoint exactly what's causing them.
What do you mean? Have you done a blood analysis?
Please, of course we did. Do you think we're stupid? Nothing showed up on the CRP, antibody titer, or WBC count. Other tests came up with nothing too. We're stumped.
Oh, that is indeed odd.
Well, hopefully this will be an uneventful op. Let's begin.
then, let's begin the operation.
Gabe, that is Dr. Cunningham, says it's like Kaposi's sarcoma. Who knows what it actually is, though?
The foci show discoloration, like malignant melanoma. Let's begin by treating the skin. Prepare the laser.
Whoa, watch it with that thing. It's not harmless, you know.
First affected area removed, incinerating the rest.
They're all burned off. Put antibiotic gel on the wounds. There aren't any more here. Let's check the intestine.
No, we're not done yet. There may be tumors under the skin here as well. Want to check the area with the ultrasound. Thought so. Tumor confirmed. Making an incision. Cytoplasm is spilling out. I'll use the drain on it. Now I'll excise it with a scalpel before it leaks. Tumor excision complete. I'll extract it with the forceps. Let's treat the excised area. Get the synthetic membrane.
I'll leave the tray out if you need to put that back.
Synthetic membrane in place. Affixing it with antibiotic gel.
Looks like all the skin tumors are done. Let's keep going.
Understood. Making an incision to open the operating field. Area disinfected. Making an incision.
Now, if it's the same as the skin, tumor should be here too.
First, we need to inject blue medicine into the inflammations. Inflammation has subsided. Let's treat the rest too.
You've got to inject it directly into the inflammation. There are probably more inflammations around.
I'm shifting my view. Prepare the magnification tool. Inflammations are all over the field of operation.
Into the inflammation.
The inflammations are all treated. Let's find the tumors now. I want to check the area with the ultrasound. Tumor presence confirmed. Treating it and inflammations. Number 2. Looks like there's another one though. Beginning treatment of the remaining wounds.
The small intestine has been treated. We're doing well.
Don't relax yet. We still need to treat the lungs.
I know. You're pretty blunt, aren't you?
Get ready to shift the focus of the operation. I've found small tumors in the lungs. Prepare the laser.
with the ultrasound.
I found a tumor. Scalpel.
It's not a tumor. Is this mucus?
This doesn't change our treatment. Let's continue, using the drain on it.
There have to be more of those. Use the ultrasound.
This must be the cause of that mucus. Beginning extraction. Exoma extraction complete. That should stop the mucus. Tumor markers aren't decreasing. Must be the mucus.
What is this? Some kind of bruise?
Bruise.
Hey, what's wrong? Are you alright?
I'm all right. Continuing with the operation.
Hell, is that mucus moving?
One myxoma extraction. It's not over yet. There should be more. mucus and remaining wounds.
Whew, we can finally relax a little. All right, let's close this patient up and finish this off. Hey, how did you know how to treat those things?
I don't know. Black bruise. I've seen it somewhere before.
Where would you see something that weird before?
Let's finish the operation. Get the antibiotic gel ready. All treatment has been complete. Ending operation.
Well, you know, you're a big help. Let me at least thank you.
My part of this is over with. She's in your hands now.
Don't you worry, we'll take care of her.
Yo, how'd it go?
All the tumors have been extracted. It's a unique condition, so keep her fully monitored.
You're just leaving now? That's pretty irresponsible.
I'm a prisoner. I can't do anything else from here.
Well, not exactly. You're responsible for that patient until she leaves.
I heard that you'll be in custody here for a while. Let me tell you that I'm firmly against this decision.
Your new room's over there. It's barred, but it's no icebox. We'll be counting on you to help us save lives here, kid.
Satisfied?
Are you kidding? I need to see how he does before I decide. Besides, his entourage is a pain in the ass, too.
What do you mean by that?
Don't treat me like an idiot, G-Man. I see a lot of new faces around here. Curious faces.
Dr. Wim.
Whoa, whoa. I try not to get involved in other people's jobs. Let's just agree not to interfere with each other. Got it?
Thanks for your cooperation.
What are you doing? You're late.
Oh, hey, Chief. Oh, sorry I'm late.
And you're all out of breath, too. Odd. Where were you?
Out in the courtyard?
The courtyard, huh? Oh, what's your take on this, kid?
It's a lie. The courtyard is less than 90 seconds away. Even if he'd run from there, he wouldn't be breathing this hard.
I saw that too. Where were you really, Dr. Freebird?
Well...
Enough. I know you're all friends, but playtime's over. Let's begin the conference. About 10 minutes ago, a Ferris wheel collapsed in Oakdale. We're receiving 4 patients, one of whom is severely injured. The patient's name is Charlie Malone, a 39-year-old male. He has a steel beam in his abdomen and needs surgery stat.
So we have his ID. Has his family been notified?
That still needs to be done. Gabe, I'll leave that to you. Now, about the surgery itself.
Chief, if I may.
Huh? What is it, Tomoe?
Why not ask him to perform the procedure?
Me?
I've seen the video of his operation. He's better than us. Severe organ damage is anticipated and will need his skill.
I did see him in action. I agree. He's amazing.
Well then, it's decided. We'll count on you, kiddo.
What the? Hey, be careful.
Is this the urgent
Where
patient?
should we take him? Has anesthesia been
Is
alerted?
everyone
ready? Nurses, prep for surgery.
Please move. Make way.
Blood pressure 60/34. GCS is 3-3, blood type O+.
Secure a blood transfusion line and get him to room A.
Let's move. You! Get out of the way!
Please, listen carefully. This will require several steps. I will monitor the transfusion, so watch the patient's vitals. Doctor, is something bothering you?
I'm not worried, it's just...
Vitals flat. Doctor!
Damn it! Hang in there!
Readying the lactated ringer solution.
No time. Contact surgery. We're bringing him in as is.
Just...
How we handle this crisis will affect the hospital's name. Is it all right to trust this to an outsider like me?
You've let your short time here mislead you in understanding us. You aren't regarded as an outsider here anymore, Doctor. You've already saved 2 lives since you arrived here. All of us believe in our hearts that you'll save this man.
Believe.
Cardiac arrest, 1 minute. Hemorrhaging won't stop.
God damn it! We're not gonna let him die on us.
Let's go. Patient seems to have arrived.
The extraction of the foreign object is a delicate procedure. I, Tomoe Tachibana, will be supporting you in this task.
Let's get to it.
We'll save this patient, no matter what. Very well. Let's do our best and begin the operation.
Patient's in critical condition. Let's be careful.
Doctor, the patient's undergoing cardiac arrest.
Charge the AED. Beginning resuscitation.
Activate the defibrillator when the gauge is green.
Come back, come on!
We have a pulse! Thank goodness!
All right. Resuming treatment of foreign objects.
It's possible that material-like wires penetrated the organ. Use the ultrasound to see what condition the organ is in.
Just need to pull them straight out of the wound. The glass shard has been extracted. Where's the tray?
Glass shard removed. Please continue with the treatment. The blood is in the way. Please drain it quickly. It It may be bent inside the wound, so please be extra careful. Please place the object in the tray.
The wire has been extracted. Moving on to other areas. I-beam extraction. Let's open the wound.
A blood pool has formed at the incision area.
Let's pull it with the forceps before the blood pools.
It seems so deep. We can't remove it all at once.
We'll have to open the wound and pull it out bit by bit. Ventricular fibrillation. Don't touch him.
Oh, please. Stop. Cardiac arrest. Charging the AED.
Come back. Come on. We have a pulse. Watch the vitals for any variations. Blood pool is going to form once we make an incision.
Pull on the object with the forceps. Watch the vitals.
We're halfway there. I'm continuing with the treatment.
The patient's getting worse. Doctor, what... Just a little more. Hang in there, doctor.
His vitals aren't stabilizing.
The object has been extracted. Please move it to the tray.
The object has been completely removed. He'll be okay for now.
Yes. Now we have to treat the wound from the extraction.
We need to do something about that blood. Get the drain. Ready the ultrasound. I'll suture it after closing the wound. Forceps. All right, now to suture it. Prepare the sutures. Suturing completed. Let's use membranes as
The patient's in danger.
See hemorrhaging in
Be
the
aware of
operating
the
area.
vitals.
Use the gel.
Please place the other membranes in the same way.
The EKG has calmed down. Let's return to the treatment. The membrane came off because of the blood pool. Let's drain it.
Only one area remains. We have a visual. There's hemorrhaging inside.
Making an incision.
Collected blood spilling out.
Blood removal confirmed. Now suturing the wound. The wound has been sutured. Moving on to other areas.
We lost sight of the hemorrhage. Use the ultrasound again.
The wound is fully covered. Fix them in place with gel. All the membranes have been affixed. They'll be all right. This wound is large enough to need the forceps to close.
The blood has formed another pool. Please use the drain on it. An abnormality on the EKG. Doctor, please.
Damn it! Get the defibrillator ready.
Come back, come on!
We have a pulse. Well done, Doctor. Large laceration treatment complete. Please continue.
Close this wound before another blood...
Please suture the wound before it opens again.
Vitals still aren't stable. There must be something hiding. Vitals still aren't stable. There must be something hiding. Vitals still aren't stable. There must be something hiding.
Vitals have stabilized. All treatment completed.
All right, let's begin suturing the operation field. Let's close this patient up. Prepare the sutures.
Please place the bandage and we can end the operation.
Operation complete. Let this disease pass with this one.
Well done. You did it, Doctor.
Vitals are stable. Should be all right now.
Well done, Doctor. This is your victory. Well done indeed.
Operation complete. Thank you for your assistance in the procedure.
He's really something. It's like a machine. Seriously, that kind of skill is just incredible. Right? Oh, is that your daughter? She's a cutie.
That's right.
It's good she didn't take after her dad. How old is she?
She would be 14 now, if she were still alive.
When did she pass away?
She was killed in a bioterrorism attack 8 years ago.
8 years? Don't tell me. Oh, sorry.
It's in the past now.
That incident at Cumberland College.
My wife taught there. She passed away with my girl.
Hey, did they ever find who was responsible?
Yeah. I caught him. Personally. Don't you recognize him? He's standing right there.
Are you joking? He did that?
A side effect of the gas. It erased his memory. But he was found guilty in a court of law for it.
That bastard! Hey, Maria!
Well done, Doctor.
That was as smooth as last time. It's like nothing can stop you.
Emma, stop swooning over the new doc.
Hey! You convict bastard!
Hey!
Is it you?
Dr. Torres!
Did you do it?
What the...
What are you talking about?
Are you responsible for Cumberland College? Tell me!
I've already been put on trial for what happened there.
Damn it!
What are you doing?
So what then? Have you been lying to us all this time?
Please, calm down, Dr. Torres.
Damn it, we swore an oath to do no harm!
Dr. Torres, calm down.
Maria, stop it!
You can't remember, huh? Screw you! Start remembering! Remember what you did, damn you!
I'd like to return to my room. Could you escort me there?
It's a request for surgery. Is he still not,
It's a waste of time even speaking to him.
Why are you turning your back on everything? Look, if you just say you aren't the culprit, we'd all...
When I came to... When I came to, all I saw was a mountain of corpses. They were gone. Hollow eyes. Blood everywhere. I may have been the one that killed them.
Are you fine with that? What, you know for sure it was you? You're just running away! You can't hide from the truth!
Had enough. Please. Leave me alone.
Ugh! You fool!
I brought your meal. Please, eat at least some of it.
It was all just a dream.
A dream?
I'm a prisoner. I'm different from everyone else. That's all there is to it.
So, Doctor, what do you think of him?
What do you mean? The kid's one heck of a surgeon.
I've been watching him a long time. I can't believe that he's the one who did it.
Well, that's an odd thing to say. You're the one who caught him.
All we do is catch criminals. We don't decide their fate.
Ah, it's very noble of you. So, what do you want from me?
I think you'd agree. You and I have a lot in common. Look, we transferred him here hoping his memory'd return. I'd really like your help in our investigation.
Screw that. And you and I are nothing alike. I'm not an idiot who'd force a doctor without passion to operate.
Treatment room 2! Hey, Darnell, where's Dr. Torres?
She went to get Dr. Cunningham. Go ahead and get ready for surgery.
I'll have everything ready in 5 minutes. I'll tell the nurses to prep for the operation.
Did you come to laugh at me?
I didn't hear any jokes. Sorry. Not my sense of humor.
It's all right. I heard your wife and daughter were...
Don't get me wrong. I'm only here because it's my job.
What?
The past is gone. But life continues. My wife fought to the end to save all her students. Just as the doctors here are fighting even now. But you... what are you doing? You're cleared for surgery. You ever dream about saving lives? Now's the time to start.
Dream about saving lives?
Cry if you want to. It's all part of growing up.
Careful with the anesthesia. It's a hardy procedure.
Yes, sir.
Respiratory's ready. Get the curettes.
Doctor.
You?
Please let me do this operation. Please. Let me save this life.
The room is yours, Doctor. Now hurry up and get ready for surgery. We're dealing with Wormer syndrome here. Got it? First, the pituitary glands, then abdomen and pancreas.
Understood. Please begin the anesthesia.
I made the incision into the sella turcica and duramater. I'm handing the reins of this operation to you.
Yeah, leave it to me. First we need to treat the blood pool. Let's use the drain. Tumor location confirmed. Beginning extraction.
Considering what we're dealing with, use extra caution.
That won't be a problem. I'll drain the cytoplasm first. Cytoplasm removed. Beginning excision with the scalpel.
The blood pool's in the way. Use the drain on it.
Tumor has been excised. Now extracting.
All right, we're making good time. Keep it up. The patient's hemorrhaging a lot. Our supply's good. The blood pool's in the way. Use the drain on it. Tumor markers are decreasing. Good. This keeps up. close up here. Leave it to me.
What are these bruises?
Oh, just blood spots. They'll go away after this.
Understood. Beginning pancreas operation. There's a high amount of hemorrhaging and inflammations as well.
Is the bleeding from the GI perforation? We should treat it first.
We'll need to excise the area around the hole to treat it.
Another blood pool is formed. Drain it. It'll open up again, so suture it shut right away.
Alright, perforation has been sutured.
Not so fast. I have some synthetic membranes here. Put them in place to reinforce the wound. I'm counting on you.
If you take too long, the sutured area is covered. Fixing them with gel. Moving to the next affected area.
Treat inflammations with medicine from the dark blue vial.
The inflammations have subsided. Continuing treatment.
Small tumors, huh? I'll get the laser and gel ready to use.
Moving operation field. There should be other areas.
Use the magnification tool then. Look for hidden tumors. Be more careful. Inject directly into the inflammation. Aren't stabilizing. Must be something.
Tumor presence confirmed. Beginning extraction. Tumor excised. Moving it to the tray now.
Don't forget to treat those small tumors as well.
Excision complete. Moving on to the next treatment. Let's close the wound. I'll need forceps.
Be careful. Vitals are dropping. Be careful. Vitals are dropping. Aren't stabilizing. Must be something.
Let's go to the next area.
Yeah, this next part's the last one. I'm counting on you. All this blood. Where's this hemorrhaging from?
We need to treat all of it. Keep an eye on the vitals. Tumor confirmed. Beginning extraction.
Looks like there are more. Fine, nicely done. Now use antibiotic gel to affix them.
Leave the drain. Now closing before suturing the wound before it opens. Prepare the sutures. Perforations been sutured. Hit the membranes.
Nicely done. Now use antibiotic. The membranes have been affixed. Move to the other areas. Tumor markers are clear.
Now to affix the membranes. Prepare the antibiotics. Excising tissue near the perforation. Scalpel. Draining blood pool. Ready to drain.
Close the wound now, before another blood...
Suturing the wound before it opens. I'll need sutures.
What? The needle fell in? Damn it, why at a time like this? We don't have much time. The patient won't last long.
Set the ultrasound wavelength for multiple analysis.
The ultrasound? What's that gonna do?
The needle's metal. It'll appear as a shadow if we scan.
All right, the ultrasound's ready. Let's hurry.
Found it. Retrieving it now. Retrieve the needle. Resuming the treatment. Suturing complete. Now to apply the membranes.
Nicely done. Now the membrane's fallen off. Drain the blood and start over.
Now to affix the membranes. Prepare the antibiotic. Treatment of all affected areas is complete. Closing up.
Whew. I was pretty worried for a moment there. Close up the operation field, and we'll be done.
I see the blood spots are gone.
Yeah, all thanks to one skilled surgeon.
Closing the operation field. Prepare the sutures.
Man, you sure can take a compliment.
Taping the sutured incision, and the operation's done. Operation complete. This disease passed from this way.
Well, you know, to be serious for once, thanks for saving this patient.
Doctor,
Whoa, stop right there. Let's not ruin the moment. You saved another life. That's more than enough. Here. Oh, you're such a sucker, kid. No, but I mean it. Really something.
That was an amazing operation. Thank you.
it's all right.
Come, I'll escort you back to your room. Is something wrong?
No. Let's get going.
Hey, would you mind coming somewhere with me first? I gotta run some papers down to emergency. You can lock a man up, but you have to respect his wants. Especially if it's something honorable. Hey, here we are. What do you think of the building? Seen better days, huh?
I'd assume so.
Now, this is the old ward. The rest of us moved into the new one. But emergency's still here. Do you know why? The people here wrestle with life and death every day. They're under more intense pressure than most can imagine. It can make them sensitive to serious issues about life.
Yeah.
Well, somehow I doubt they'll move to the new ward. Now go on.
Be right back. Gotta take this report to the medical office.
Stop by the service department, too. They paged us earlier.
Okay, I'll stop on my way back. Oh, excuse me.
If you have Hank's papers, you can drop them there.
All right.
Okay... fixed. Ugh, you piece of crap! What's the use? This ward's such a pain. Is it too much to ask to have working lights?
I see. Yeah, that's, unfortunate.
Huh? You still need something?
No, it's nothing. Sorry.
It wasn't you, right? You're not the one behind the terrorist attack, are you? You have no memory, but you just want to scream it out. Am I wrong? That's how I was when I was a kid. I think I lost my temper the other day. I'm sorry.
No,
Anyway, I know you aren't a murderer. At least, I don't think you are. So, let's drop it.
Why are you being so...
Hey, I got a lot to do here. You mind?
Huh? Wait, I'd still like to...
Bastard! What the hell did you break?
I didn't mean to. I was just...
If you just quit moping, it wouldn't have happened.
No, my personality has nothing to do...
Damn it, just shut up already!
Everything has been documented in the files before you. Please increase the bromocriptine dose to 6 milligrams. And that concludes my report.
Thank you, Doctor.
Don't cry, Emma. It's disrespectful to the doctor.
It was a pleasure working with you. Don't forget us.
Yeah.
Going back to your fridge, huh?
That's right.
Huh. 14 operations, that's 26 years off your sentence.
That doesn't interest me.
Hey, throw me a bone or something. Cheer up, will ya?
My sentence is 250 years. I have 217 left. And maybe if I were a monad, I'd live out my entire sentence.
Is that a joke? I don't know if I should laugh. Come on, don't worry. I won't pull it back or anything. Take care of yourself.
Yeah. Thank you for everything.
Huh? Huh? Maria? No one said anything about a transport. What happened?
Her condition is critical. She was hurt in a bombing.
A bomb? You idiot, we can't treat her here.
Why? She needs to be admitted for emergency surgery.
Third-degree burns mean a debridement and a skin graft. We have no tissue to transplant. How can we operate?
Maria, lower the patient.
You idiot! What are you saying?
We can do it without skin grafting. I can save her.
You? But your stay here is over. Look. They're panicked. They think you're making an escape.
No, I'm not turning my back on saving lives anymore.
God damn it. All right, but whatever happens, don't blame me. Maria, you heard the man. Lower the stretcher. Hurry! FBI, get out of the way!
Excuse me! Please move!
Don't move! This is the FBI!
Get your hands up! Huh?
You mind? This is a hospital, fellas. Keep it down.
Doctor, where is he?
I'm not armed. Go point that thing at someone else.
His approved time at the hospital is up. Understand? Don't do anything to make his situation worse.
Holden, you and I are alike after all. We both do whatever it takes to get the job done.
What the?
Damn it! Pursue them! Request backup and stop that chopper!
Don't worry. I promise that I'll save her.
We need as many men as local police is able to spare. It's the chopper! We intercepted their in-flight radio! Connect me to it, right now.
Must use extreme caution. Ready for briefing, Doctor?
Yes, please begin.
They're operating in the chopper? They'll kill the patient!
Be aware, too, that we don't have stable voltage levels. This is not going to be easy, Doctor.
Understood. After debriding the burns, I'll need the synthetic membranes. Keep the antibiotic gel ready, too. Let's begin. It seems there are both second and third degree burns.
This will be a race against time. Let's begin quickly. Inject the light blue coolant inject coolant from the light blue vial into the...
Now to place a membrane before blood pool forms.
You can place...
Let's hurry up with these.
Please use the antibiotic gel on the burns indicator. Please continue treatment.
That's one glass shard removed. It's bent inside the body. I'll have to extract it carefully.
Please place objects. Another blood pool is formed. Please drain it. Using the ultrasound will help you determine the wire's shape.
Moving on. Beginning burn treatment.
Be careful. The third degree burns need a coolant and inject coolant from the light blue vial into the black burns. Inject coolant from the light blue vial into...
Coolant's taking effect. Performing debridement. Debridement complete. Removing necrotic tissue now. Let's treat that blood pool. Prepare the drain. Let's hurry up with these.
The second membrane is put. One more. Hang in there, Doctor.
That should do it. Moving on to the next treatment.
Use the magnification tool to move the view of the operation. There's a lot of hemorrhaging. Be aware of the vitals.
Wires have been extracted. Beginning the next treatment.
All glass shards removed. Let's move to the next step.
Coolant's taking effect. Performing debridement. Debridement complete. Removing necrotic tissue now. Let's treat that blood pool. Prepare the drain. Let's hurry up with these. We don't...
The second membrane is placed.
inject tissue now. Let's treat that blood pool.
I'll keep the tray ready for you. Use it when you need to.
Let's hurry up with these. We don't have time to waste. I need to work faster, with precision. Let's hurry up with these. We don't have time to waste. Let's hurry up with these. We don't have time to waste.
The membrane fell off. Drain the blood and try again. There isn't much left, but don't let your guard down.
Hemorrhaging under the skin. I need the scalpel. Suturing complete. Looks like there's more, though.
Thank goodness. The treatment is complete.
Don't look away from the monitor. Something
Cardiac arrest! Charge the AED!
Yes, but why did she go into cardiac arrest?
There's no time for questions. Using the defibrillator. What's going on?
The electricity's going out. Please halt the procedure.
All the time. Why now? I can't see where I'm working. Is the power back on yet?
Vitals dropping. Her pulse hasn't returned either.
Damn it! Come on, make it in time.
What's with the tunnel? You mind flying a bit higher?
Stop complaining, damn it! Any higher and they'll find us.
Can you hear me? We got some distance from Resurgam.
Is the voltage check ready yet?
Vitals are dropping. She's in critical condition.
Looks like they're having a rough time.
Whoa! Damn it! Now what?
Doctor, I assume you can hear me. Drop altitude and land your helicopter at once.
Huh. Well, this isn't good. Looks like this is it.
Doctor, the game's over. Give him to me.
The game's over? Give you... who? Maria, you got any idea what he's talking about?
Yo, old man, this chopper's for material transport. I don't think what you're looking for is on board.
Cardiac arrest.
It's not over yet. I'll massage the heart. Hurry up.
Get back in the helicopter! He's still at Resurgam!
Damn it! This is the old ward, but I didn't expect this. Cardiac arrest, 4 minutes. Still no power? Not yet!
Dr. Freebird should be at the power room by now.
Dr. Freebird.
Hurry! After we resuscitate her, we've got to close her up.
AED's charged. Doctor, please begin resuscitation.
All right. It's not too late. She can still be saved.
The AED's charged. You can use the defibrillator now.
All right, here goes.
Come on.
We have a pulse. She's all right.
Her organs must have been damaged as well to cause that.
Don't tell me. Did the bomb?
Let's open her up and confirm it. Prepare for surgery.
Can you hear me? It's me, Gabriel.
It's a radio transmission from the helicopter.
Sorry, but we ran into some trouble. They're heading back. Once they surround that place, you'll never get to finish. You've got about 10 minutes. Get it done in that time, okay?
Doctor!
Focus on the operation. Let's keep treating her.
The broken ribs are piercing the organ.
Thought as much. Let's hurry up and extract those bone fragments.
Another blood pool may form.
These wounds are too big. We can't treat all of them at once.
Yes, if it reopens, the damage will be tremendous. Let's suture each one carefully before moving to the next.
All right.
Another blood pool may form, so please close the wound. The first wound has been sutured.
Let's suture this before it opens again. We'll have to treat one wound at a time. I'll need the forceps.
One more. This is the last wound to suture. Stay sharp. Use the synthetic membranes. The membrane has been placed. Please continue.
All right. Now to use antibiotic gel to affix it.
The organ damage has been treated. Please remove the fragments.
One bone fragment retrieved. She's hemorrhaging badly.
Another blood pool may form, so please close the wound. The patient's in danger. Be aware of the vitals. Before you treat the other wounds, another blood pool may form.
All right. Proceed.
Please suture the closed wound before doing anything
We'll have to
further.
treat one wound at a time. I'll need the forceps.
One more.
I need to suture it before it opens up again. Surgeons!
Use the synthetic membrane to seal the wound.
Continuing with the treatment. Bring the next membrane.
Membranes have been placed. Please use gel to fix them.
There are more bone fragments left. I need to remove them.
Retrieval is going smoothly. Please continue carefully.
begin restoring the ribs.
The fragments will be on the tray. Place them carefully. There are several areas, so move the view accordingly.
can't reconstruct a rib if I'm not in the right... All right, bring out the next bone. We're not done placing them yet. Continuing treatment. Is it her liver? We don't have a choice. We have to look and confirm it. The liver's been damaged so much.
We can expect changes in the patient due to hemorrhagic shock. Please be aware of the vitals while performing treatment.
Yes, we'll save her, no matter what.
This is Gabriel. You don't need to answer, just listen. There's no time. This is our last message. Listen carefully. Kid, let Tomoe take over the operation and get out of there.
What?
Oh, and, you did great, you know? Really an awesome surgeon.
I'll take over the procedure. Please, you need to go.
Hand me the size 11 PM.
Doctor, there's no time. You need to...
I'm not running away. I'm always run. From whatever sins I may have committed. I won't run anymore. From the lives I've hurt, or from the ones I can save.
Doctor, let's continue the treatment. We have to hurry. There are signs of ventricular fibrillation. No! Stop everything during fibrillation.
She's going into cardiac arrest. Get the defibrillator.
We've got a pulse. Let's hurry before it happens again. Another blood pool may form, so please close the wound. Before you treat the other wounds, suture the closed.
We'll have to treat one wound at a time. I'll need the forceps.
The first wound has been sutured. Please continue treatment. Another blood pool may form, so please close the wound.
Let's suture this before it opens again. We'll have to treat one wound at a time. I'll need the forceps.
One more. This is the last wound to suture. Stay shut. Use the synthetic membranes to seal the wounds shut. The patient's in danger. Be aware of the vitals.
Alright, now to use organ damage has been treated. Now to treat these wounds. Another blood pool may form, so please close the wound. Before you
wounds.
We'll have to treat one wound at a time. I'll need the... Alright. Proceeding to the next wound.
Please suture the closed wound before doing it. Another blood pool may form, so please close the wound. One more.
I need to suture it before it opens up again. Sutures!
Use the synthetic membrane to seal...
Is she going into ventricular fibrillation? Don't scare us.
Membranes have been placed. Please use gel to fix them.
All treatments are complete. That should do it.
There are abnormalities in the EKG. Incoming cardiac arrest. It's a big one. No, please resuscitate her. Her pulse isn't coming back.
It's not over. She can still be saved. Increase the voltage. Charge it again.
AED is set. Please watch the gauge's speed. It's no good. Her pulse still isn't returning.
One more time. Don't give up.
She's flatlining. Doctor, she isn't going to...
Alyssa, please. You've got the whole world ahead of you. You're not alone. Teach me what it means to live.
Her vitals have returned. This...
Right. Operation complete. Let's close her up. Closing the operational area. Sutures, please.
Right away.
Alyssa did well by hanging in there. Bandage.
We don't have much time. Please hurry with the treatment.
Ending the procedure. Let this disease pass from this world.
Amazing. You really saved her. That was amazing. It's all thanks to you, Doctor.
No. I just did what I was meant to do.
Doctor, thank you so much.
Get out of the way!
There's a procedure going on. No one's allowed to enter.
I have a job to do. Get out of the way or I'll use force.
That'll be enough. Please move aside, Dr. Freebird.
Dr. Tachibana.
The operation was successful. I won't run or hide from you.
How ironic. You throw everything away, all to save a patient. Take him away.
You all done?
I'll leave his things behind. My men can handle the rest.
I heard we won't be held accountable. How generous of you.
There's no proof you deliberately helped him evade capture. It's a waste of time charging you with something like that.
Huh. I didn't know you guys ever went just by the book.
There's a time and place for everything, Doc.
So what's gonna happen to him?
He'll return to his cell with no further outside contact.
Thought so.
Believe in him.
Hmm?
Coming here's changed him. That's what I believe, at least.
You think so? I think you're right.
What?